Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 Nclex-Rn nursing examination multiple choice questions and answers. Read the question by yourself and find the correct answer. Let's begin.
306. A nurse is performing a prenatal examination on a client in the third trimester. The nurse begins an abdominal examination and performs Leopold maneuvers. The nurse determines which of the following after performing the first maneuver: 1. Fetal descent. 2. Placenta previa. 3. Fetal lie and presentation. 4. Strength of uterine contractions. Answer: 3. Rationale. The first maneuver determines the contents of the fundus, either the fetal head or breech, and thereby the fetal lie. Fetal descent is determined with the fourth maneuver. Placenta previa is diagnosed by ultrasound and not by palpation. Leopold maneuvers are not performed during a contraction. 307. The nurse is caring for a client with a spinal cord injury who has spinal shock. The nurse performs an assessment on the client, knowing that which assessment will provide the best information about recovery from spinal shock. 1. Reflexes. 2. Pulse rate. 3. Temperature. 4. Blood pressure. Answer: 1. Rationale. Areflexia characterizes spinal shock, therefore reflexes would provide the best information about recovery. Vital sign changes, options 2, 3, and 4, are not consistently affected by spinal shock. Because vital signs are affected by many factors, they do not give reliable information about spinal shock recovery. Blood pressure would provide good information about recovery from other types of shock, but not spinal shock. 308. A client is admitted to the hospital for repair of an unruptured cerebral aneurysm. Before surgery, the nurse performs frequent assessments on the client. Which assessment finding would be noted first if the aneurysm ruptures? 1. Widened pulse pressure. 2. Unilateral motor weakness. 3. Unilateral slowing of pupil response. 4. A decline in the level of consciousness. Answer: 4. Rationale. Rupture of a cerebral aneurysm usually results in increased intracranial pressure, ICP. The first sign of pressure in the brain is a change in the level of consciousness. This change in consciousness can be as subtle as drowsiness or restlessness. Because centers that control blood pressure are located lower in the brain than those that control consciousness, pulse pressure alteration is a later sign. Slowing of pupil response and motor weakness are also late signs. 309. An emergency department staff member calls the mental health unit and tells the nurse that a severely depressed client is being transported to the unit. The nurse in the mental health unit expects to note which of the following on assessment of this client: 1. Reports of weight gain, hypersomnia, and a blunted affect. 2. Reports of crying spells, normal weight and sleep patterns. 3. Reports of a reluctance to participate in activities, but a normal effect. 4. Reports of substantial weight loss, insomnia, and decreased crying spells. Answer: 4. Rationale. In the severely depressed client, loss of weight is typical, while the mildly depressed client may experience a gain in weight. Sleep is generally affected in a similar way, with hypersomnia in the mildly depressed client and insomnia in the severely depressed client. The severely depressed client may report that no tears are left for crying. 310. A client admitted to the hospital is suspected of having Guillain-Barré syndrome and the nurse performs an assessment. The nurse next reviews the client's medical record, expecting to note documentation of which manifestations of this disorder. Select all that apply. 1. Dysphagia. 2. Paresthesia. 3. Facial weakness. 4. Difficulty speaking. 5. Hyperactive deep tendon reflexes. 6. Descending symmetrical muscle weakness. Answer: 1, 2, 3, 4. Rationale. Guillain-Barré syndrome is an acute autoimmune disorder characterized by varying degrees of motor weakness and paralysis. Motor manifestations include ascending symmetrical muscle weakness that leads to flaccid paralysis without muscle atrophy, decreased or absent deep tendon reflexes, respiratory compromise and respiratory failure, and loss of bladder and bowel control. Sensory manifestations include pain, cramping, and paresthesia. Cranial nerve manifestations include facial weakness, dysphagia, diplopia, and difficulty speaking. Autonomic manifestations include labile blood pressure, dysrhythmias, and tachycardia. 311. A home care nurse finds a client in the bedroom, unconscious, with a pill bottle in hand. The pill bottle had contained the selective serotonin reuptake inhibitor, sertraline, Zoloft. The nurse should immediately assess which of the following: 1. Pulse, 2. Respirations, 3. Blood pressure, 4. Urinary output. Answer: 2. Rationale: in an emergency situation, the nurse should determine breathlessness first, then pulselessness. Blood pressure would be assessed after these assessments were determined. Urinary output is also important but is not the priority at this time. 312. A nurse checks a unit of blood received from the blood bank and notes the presence of gas bubbles in the bag. Which should the nurse implement? 1. Return the bag to the blood bank. 2. Infuse the blood using filter tubing. 3. Add 10 ml normal saline to the bag. 4. Agitate the bag to mix contents gently. Answer: 1. Rationale: the nurse should return the unit of blood to the blood bank because the gas bubbles in the bag indicate possible contamination. If the nurse were going to administer the blood, the nurse would use filter tubing to trap particulate matter. Although normal saline can be infused concurrently with the blood, normal saline or any other substance should never be added to the blood in a blood bag. The bag should not be agitated because this can harm red blood cells. 313. The nurse checks the gauge of the client's intravenous catheter, which is the smallest gauge catheter that the nurse can use to administer blood. 114 gauge, 219 gauge, 322 gauge, 424 gauge. Answer: 2. Rationale: an intravenous catheter used to infuse blood should be at least 19 gauge or larger to help prevent additional hemolysis of red blood cells and to allow infusion of the blood without occluding the fork catheter. A 22 or 24 gauge catheter is too small to infuse blood. 314. A client began receiving an intravenous 4 infusion of packed red blood cells 30 minutes ago. The client turns on the nurse call light and describes difficulty breathing, itching, and a tight sensation in the chest. Which of the following is the first action of the nurse? 1. Call the physician. 2. Stop the transfusion. 3. Check the client's temperature. 4. Recheck the unit of blood for compatibility. Answer: 2. Rationale: the symptoms reported by the client indicate that the client is experiencing a transfusion reaction. The first action of the nurse when a transfusion reaction is observed is to discontinue the transfusion. The foreline is kept open with normal saline and the physician is notified. The nurse then checks the client's vital signs, temperature, pulse, and respirations and then rechecks the unit of blood as appropriate for infusion into the client. Depending on agency protocol, the nurse may also obtain a urinalysis, draw a sample of blood, and return the unit of blood and tubing to the blood bank. The nurse also institutes supportive care for the client, which may include administration of antihistamines, crystalloids, epinephrine, or vasopressors as prescribed. 315. A client has not eaten or had anything to drink for 4 hours following 2 episodes of nausea and vomiting. Which of the following items would be best to offer the client who is ready to try resuming oral intake? 1. Toast. 2. Gelatin. 3. Dry cereal. 4. Ginger ale. Answer: 4. Rationale: clear liquids are best tolerated first after episodes of nausea and vomiting. If the client tolerates sips, 20 to 30 milliliters at a time, of clear liquids, such as water or ginger ale, with the carbonation removed if better tolerated, then the amounts may be increased and gelatin, tea, and broth may be added. Once these are tolerated, solid foods such as toast, cereal, chicken, and other easily digested foods may be tried. 316. A client has just undergone an upper gastrointestinal (GI) series. Upon the client's return to the unit, the nurse should check the physician's prescriptions for which of the following is a part of routine post-procedure care. 1. Bland diet. 2. NPO status. 3. Mild laxative. 4. Decreased fluids. Answer. 3. Rationale, barium sulfate, which is used as a contrast material during an upper GI series, is constipating. If it is not eliminated from the GI tract, it can cause obstruction. Therefore laxatives or cathartics are administered as part of routine post-procedure care. Increased, not decreased, fluids are also helpful but do not act in the same way as a laxative to eliminate the barium. Options 1 and 2 are not routine post-procedure measures. 317. The nurse prepares the client for the removal of a nasogastric tube. During the tube removal, the nurse instructs the client to 1. Inhale deeply. 2. Exhale slowly. 3. Hold in a deep breath. 4. Pause between breaths. Answer. 3. Rationale. Just before removing the tube, the client is asked to take a deep breath and hold it because breath holding minimizes the risk of aspirating gastric contents spilled from the tube during removal. The maneuver partially occludes the airway during tube removal. Afterward, the client exhales as soon as the tube is out and, thus, avoids drawing the gastric contents into the trachea. The nurse pulls the tube out steadily and smoothly while the client holds the breath. The remaining options are incorrect because options 1 and 2 increase the risk of aspiration, and option 4 is ineffective. 318. A nurse is caring for a client who is receiving parenteral nutrition and has a prescription for an intravenous intralipid infusion. Which does the nurse implement before hanging the intralipid infusion? 1. Refrigerate the bottle of solution. 2. Add 100 ml normal saline to the infusion bottle. 3. Place an inline filter on the administration tubing. 4. Check the solution for separation or an oily residue. Answer. 4. Rationale. Intralipids provide non-protein calories and prevent or correct fatty acid deficiency. The nurse checks the solution for separation or an oily appearance because this can indicate a spoiled or contaminated solution. Refrigeration renders the intralipid solution too thick to administer. Because they can affect the stability of the solution, the nurse avoids injecting additives into the intralipid infusion. Further, an inline filter is not used because it can disrupt the flow of solution by becoming clogged. 319. The nurse develops a discharge plan for a client with peripheral neuropathy of the lower extremities. The nurse includes which instructions in the plan? Select all that apply. 1. Wear support or elastic stockings. 2. Wear well-fitted shoes and walk barefoot only when at home. 3. Wear dark-colored stockings or socks and change them daily. 4. Use a heating pad set at low setting on the feet if they feel cold. 5. Apply lanolin or lubricating lotion to the legs and feet once or twice daily. 6. Wash the feet and legs with mild soap and water and rinse and dry them well. Answer. 1, 5, 6. Rationale. Peripheral neuropathy is any functional or organic disorder of the peripheral nervous system. Clinical manifestations can include muscle weakness, stabbing pain, paresthesia or loss of sensation, impaired reflexes, and autonomic manifestations. Home care instructions include washing the feet and legs with mild soap and water and rinsing and drying them well. Applying lanolin or lubricating lotion to the legs and feet once or twice daily, inspecting the legs and feet daily and reporting any skin changes or open areas to the physician, wearing white or color-fast stockings or socks and changing them daily, Checking the temperature of the bath water with a thermometer before putting the feet into the water, avoiding the use of hot foot soaks, heating pad, hot water bottle, on the feet because of the risk of burning, avoiding the use of sharp devices to cut nails, wearing support or elastic stockings for dependent edema, and wearing well-fitted shoes and avoiding going barefoot. 320. A physician is inserting a chest tube. The nurse selects which of the following materials to be used as the first layer of the dressing at the chest tube insertion site. 1. Sterile 4_4 gauze pad. 2. Petrolatum jelly gauze. 3. Absorbent gauze dressing. 4. Gauze impregnated with povidone iodine. Answer: 2. Rationale: the first layer of the chest tube dressing is petrolatum gauze, which allows for an occlusive seal at the chest tube insertion site. Additional layers of gauze cover this layer, and the dressing is secured with a strong adhesive tape or elastoplast tape. The items in the remaining options would not be selected as the first protective layer. 321. A client being seen in the physician's office for follow-up 2 weeks after pneumonectomy complains of numbness and tenderness at the surgical site. The nurse should tell the client that this is, 1. Not likely to be permanent, but may last for some months. 2. A severe problem and the client will probably be rehospitalized. 3. Probably caused by permanent nerve damage as a result of surgery. 4. Often the first sign of a wound infection and checks the client's temperature. Answer: 1. Rationale: clients who undergo pneumonectomy or other surgical procedures may experience numbness, altered sensation, or tenderness in the area that surrounds the incision. These sensations may last for months. It is not considered to be a severe problem and is not indicative of a wound infection. 322. A client scheduled for pneumonectomy tells the nurse that a friend of his had lung surgery and had chest tubes. The client asks the nurse about how long his chest tubes will be in place after surgery. Which of the following indicates the best response to the client? 1. They will be removed after 3 to 4 days. 2. They will be in place for 24 to 48 hours. 3. They usually remain in place for a full week after surgery. 4. Most likely, there will be no chest tubes in place after surgery. Answer: 4. Rationale: pneumonectomy involves removal of the entire lung, usually caused by extensive disease such as bronchogenic carcinoma, unilateral tuberculosis, or lung abscess. Chest tubes are not inserted because the cavity is left to fill with serosanguineous fluid, which later solidifies. Therefore options 1, 2, and 3 are incorrect. 323. The nurse is developing a plan of care for a client with a dissecting abdominal aortic aneurysm. Which interventions should be included in the plan of care? Select all that apply. 1. Assess peripheral circulation. 2. Monitor for abdominal distension. 3. Tell the client that abdominal pain is expected. 4. Turn the client to the side to look for ecchymosis on the lower back. 5. Perform deep palpation of the abdomen to assess the size of the aneurysm. Answer: 1, 2, 4. Rationale: if the client has an abdominal aortic aneurysm, the nurse is concerned about rupture and monitors the client closely. The nurse tells the client to report abdominal pain, or back pain, which may radiate to the groin, buttocks, or legs because this is a sign of rupture. The nurse also avoids deep palpation in the client in whom a dissecting abdominal aortic aneurysm is known or suspected. Doing so could place the client at risk for rupture. The nurse should assess peripheral circulation and monitor for abdominal distension. The nurse also looks for ecchymosis on the lower back to determine if the aneurysm is leaking. 324. A client has undergone angioplasty of the iliac artery. Which of the following techniques should the nurse perform to best detect bleeding from the angioplasty in the region of the iliac artery? 1. Palpate the pedal pulses. 2. Measure the abdominal girth. 3. Ask the client about mild pain in the area. 4. Auscultate over the iliac area with a Doppler device. Answer: 2. Rationale: bleeding after iliac artery angioplasty causes blood to accumulate in the retroperitoneal area. This can most directly be detected by measuring abdominal girth. Palpation and auscultation of pulses determine patency. Assessment of pain is routinely done, and mild regional discomfort is expected. 325. A client comes into the healthcare clinic stating that she thinks she has restless leg syndrome. The nurse assesses the client and determines that which data are characteristics of this disorder. Select all that apply. 1. A heavy feeling in the legs. 2. Burning sensations in the limbs. 3. Symptom relief when lying down. 4. Decreased ability to move the legs. 5. Symptoms that are worse in the morning. 6. Feeling the need to move the limbs repeatedly. Answer: 2, 6. Rationale: restless leg syndrome is characterized by leg paresthesia associated with an irresistible urge to move. The client complains of intense burning or crawling type sensations in the limbs and subsequently feels the need to move the limbs repeatedly. The symptoms are worse in the evening and night when the client is still. The client feels the need to move to relieve the symptoms. 326. A client who underwent peripheral arterial bypass surgery 16 hours ago complains of increasing pain in the leg at rest, which worsens with movement and is accompanied by paresthesias. Based on this data, the nurse should take which action? 1. Call the physician. 2. Administer an opioid analgesic. 3. Apply warm moist heat for comfort. 4. Apply ice to minimize any developing swelling. Answer: 1. Rationale: compartment syndrome is characterized by increased pressure within a muscle compartment caused by bleeding or excessive edema. It compresses the nerves in the area and can cause vascular compromise. The classic signs of compartment syndrome are pain at rest that intensifies with movement and the development of paresthesias. Compartment syndrome is an emergency, and the physician is notified immediately because the client could require an emergency fasciotomy. Options 2, 3, and 4 are incorrect actions. 327. The nurse in an ambulatory care clinic takes a client's blood pressure, BP. In the left arm, it is 200/118 mm Hg. Which action should the nurse implement next? 1. Notify the physician. 2. Inquire about the presence of kidney disorders. 3. Check the client's blood pressure in the right arm. 4. Recheck the pressure in the same arm within 30 seconds. Answer: 3. Rationale: when a high BP reading is noted, the nurse takes the pressure in the opposite arm to see if the blood pressure is elevated in one extremity only. The nurse would also recheck the blood pressure in the same arm, but would wait at least 2 minutes between readings. The nurse would inquire about the presence of kidney disorders that could contribute to the elevated blood pressure. The nurse would notify the physician because immediate treatment may be required, but this would not be done without obtaining verification of the elevation. 328. A new prenatal client is 6 months pregnant. On the first prenatal visit, the nurse notes that the client is gravida 4, para 0, aborta 3. The client is 5,600 tall, weighs 130 pounds, and is 25 years old. The client states, "I get really tired after working all day and I can't keep up with my housework." Which factor in the above data would lead the nurse to suspect gestational diabetes? 1. Fatigue. 2. Obesity. 3. Maternal age. 4. Previous fetal demise. Answer: 4. Rationale: a previous history of unexplained stillbirths or miscarriages puts the client at high risk for gestational diabetes. Fatigue is a normal occurrence during pregnancy. 5 feet, 6 inches tall and 130 pounds does not meet the criteria of 20% over ideal weight. Therefore the client is not obese. To be at high risk for gestational diabetes, the maternal age should be greater than 30 years. 329. A nurse is caring for a client with preeclampsia. If the client's condition progresses from preeclampsia to eclampsia, the nurse's first action is to 1. Maintain an open airway. 2. Administer oxygen by face mask. 3. Assess the maternal blood pressure and fetal heart tones. 4. Administer an intravenous infusion of magnesium sulfate ANSA. 1. Rationale: eclampsia is characterized by the occurrence of seizures. If the client experiences seizures, it is important as a first action to keep an open airway and prevent injuries to the client. Options 2, 3, and 4 are all interventions that should be done but are not the first action. 330. A nurse in the emergency department admits a client who is bleeding freely from a scalp laceration obtained during a fall from a stepladder when the client was doing outdoor home repair. The nurse takes which of the following actions first in the care of this wound? 1. Prepares for suturing the area. 2. Administers a prophylactic antibiotic. 3. Cleanses the wound with sterile normal saline. 4. Asks the client about timing of the last tetanus vaccination. Answer: 3. Rationale: the initial nursing action is to cleanse the wound thoroughly with sterile normal saline. This action removes dirt or foreign matter in the wound and allows visualization of the size of the wound. Direct pressure is also applied as needed to control bleeding. If suturing is necessary, the surrounding hair may be shaved. Prophylactic antibiotics are often prescribed. The date of the client's last tetanus shot is determined, and prophylaxis is given if needed.